It's 5:05. Welcome into a Tuesday edition of the Carolina Journal News Hour. News Talk 1110 99.3 WBT. I'm Nick Craig. Good morning to you. Well, late last week, the newly confirmed Secretary of the U.S. Department of Agriculture in Brooke Rollins visited western North Carolina to survey damage caused by recent wildfires and Hurricane Helene. Rollins' visit came a day ahead of the original schedule, which we brought to you early last week. In a press release, the secretary said, quote, "I met with North Carolinians who have suffered unimaginable loss from recent natural disasters. The U.S. Forest Service was well prepared, assessing wildfire risk in advance and strategically positioning resources to quickly respond. Thanks to their efforts, they were able to contain the fires swiftly. USDA continues to work closely with state and local agencies as well as first responders to support these communities and restore the public lands that so many rural residents depend on." Rollins toured the Blue Ridge Parkway damage, attended a wildfire operations briefing, and participated in a U.S. Forest Service roundtable with local leaders and community members in the Asheville area. The Hicks Cemetery fire, which was located in the National Forest within the Appalachian Range of Haywood County, affected approximately 198 acres before being fully contained on March 9th. The visit shows significant improvements from last week when there were multiple wildfires burning. We've covered that over the last couple of weeks, and we are in the right in the middle of the spring wildfire season, which does affect the western half of North Carolina. We'll have some additional details, some interesting news coming out from the Agricultural Commissioner, Steve Troxel. We'll have those details coming up for you here in just a few minutes. The North Carolina State Health Plan Board of Trustees met on Friday to discuss the urgent financial challenges that are currently facing the health plan, with officials warning that insolvency is imminent within less than 2 years without major increases to premiums or deductibles. The executive administrator of the plan highlighted a $1.4 billion deficit. This is while State Treasurer Brad Briner, who is responsible for the plan, emphasized the need to maintain solvency for more than 750,000 state employees and retirees who rely on the plan. Key proposals include increasing employer contribution, advocating for additional state funding, as well as reinstating GLP obesity management prescriptions for members with medical needs. The board also considered reducing prior authorization requirements for low-cost drugs, but debated potential risks, particularly regarding opioids. Public comment were largely opposed to premium and deductible increases, no surprise there, with state employees voicing concerns about affordability as well as staffing shortages. Testimony included that of multiple individuals who both are currently working for the state and those that are retired that still receive their medical and health care benefits through the state health plan. The board is set to deal with this over the next couple of months. They will reconvene in May of this year to finalize the 2026 benefit plans, with premium decisions and decisions about increase in prices coming out in August ahead of open enrollment, which begins in October of this year ahead of the calendar flip over to 2026. This is slated to be a major story throughout the rest of the year. We'll keep an eye on it right here on the Carolina Journal News Hour, where it's now 5:09, News Talk 1110 99.3 WBT. We have talked a lot about wildfires over the last week or two as they pertain to North and South Carolina. However, we are getting some new details this morning on where North Carolina ranks in terms of wildfires across the nation. To get some additional details on that this morning, Katie Zender, CarolinaJournal.com, joins us on the News Hour. Katie, you followed a couple of committee meetings last week involving Steve Troxler, and he said something pretty astounding about North Carolina's risk of wildfires. What are you learning this morning?
Right. Good morning, Nick. Thank you for having me on. So, yeah, Steve Troxler, the commissioner of the North Carolina Department of Agriculture, gave remarks before the Joint Committee of Appropriations on Agriculture and Natural and Economic Resources last week. And he told them that the number one state at risk of wildfires is actually North Carolina. Most people would probably assume that it's probably be a state like California, but it's actually North Carolina. And, we've got 2 fire seasons here in North Carolina, a spring season and a fall season. We're just at the beginning of our spring season. And he also said, with all the natural disasters and everything that we've experienced in 2024, North Carolina has $5 billion in losses. And he also has an overworked, underpaid Department of Agriculture.
With obviously the normal wildfire risk that the state sees, regardless of what else is going on, things I presumably are elevated out in the western half of the state, Katie. There's so much additional debris from Helene that affected the state back in September. And we heard a little bit and saw some of the implications of that last week with some of those fires burning. So this is going to be something that is probably going to be at an elevated risk more than usual as we head deeper into the spring and then probably as we head into the fall later this year.
That's right, Nick, and that's exactly what Commissioner Troxler said. We've got all this debris, all these trees and everything on the ground in the aftermath of Helene. He said that's probably going to take, up to 3 years to rot out, so that it's not just a tremendous, fire lake and a tremendous, pile of kindling sitting out there in western North Carolina.
So with that, it was this joint meeting. He was talking with lawmakers. Did he make any direct requests from them? Did they have any questions? Give us some of the back and forth that took place during the meeting.
Right, yeah. So Steve Troxler said, in all my years in agriculture, I've never seen a year like 2024 with the severity of the weather conditions and production conditions that we have seen. When you pile on top of that, low commodity prices, it's been awful. And the result has been a $5 billion loss at the farm gate level is what he's told Troxler. And before Troxler spoke, so this was actually a 2-day meeting because there was so much information to go over. Troxler spoke during the second half of the meeting on Thursday, but Wednesday and the first part of Thursday, Margaret Young from the Fiscal Research Division at the North Carolina General Assembly actually gave some presentations on, some of the numbers concerning the NC Forest Service. Wildfire response is one of the most extensive tasks of the NC Forest Service. There are 2 primary fire seasons, as we've discussed. During the 2023-2024 season, there were over 5,000 wildfires that burned more than 28,000 acres. The largest of these fires was the Collette Ridge Fire, which burned 5,419 acres. The total estimated suppression cost for that season was $7.6 million. On-call hours totaled more than 300,000 hours and were valued at almost $800,000 for the 23-24 season. She also said, so far in 2025, we've seen, almost 2,000 fires have burned almost 5,000 acres on March 2nd alone. We saw 97 fires break out, burning 224.5 acres. And I think that number is much higher now, but that's just the most current information they had at the time. The largest fire is what's referred to as the 3910 fire, or the fire that broke out in Polk County. As of March 2nd, this fire burned 630 acres. So, we're pretty far out from March 2nd, so that fire has been pretty well contained by now. But we've got some staggering numbers here. Commissioner Troxler compared actually our risk of wildfires and what we're seeing right now to what we saw back in Tennessee in 2016. He said, think about this, but that's kind of what we're looking at. And back in 2016, wildfires in Tennessee pretty much burned up the entire town of Gatlinburg. He said that's what we're looking at right now. And he said we're not prepared to handle a situation like that. One of the biggest ways that we control wildfires is prescribed burns, especially here in the South. And North Carolina is one of 11 southern states with a burn manager certification program. Margaret Young from Fiscal Research said that the NC Forest Service receives $1 million in recurring funds from the state budget appropriated by the NCGA to fund the prescribed burn cost share program, which supports private forest owners in paying for the prescribed burns to kind of manage, all this debris that's lying on the ground, not only from Helene, but, just from normal, trees falling down, decay in the forest, all of that normal just kind of upkeep to reduce the risk of wildfires. But now we have all of this on top of, what Helene left behind. So during fiscal year 2024, 170 burns occurred on more than 8,000 acres. 77% were on 100 acres or less, and the cost reimbursement share to landowners totaled more than $190,000. So, those are kind of some of the facts and figures and numbers. Troxler has submitted several requests, to the Joint Committee on Appropriations that they're going to be considering as they go in to prepare the state budget, which is what the legislature is going to be doing in the greater part of the long session that we're getting well into now. So we're going to be tracking this and keeping up to date on what they do with these requests and keep our eye on that, Nick.
Katie, there's a lot of numbers that you went through, all of them very important. Where can folks go and read those additional details this morning?
Right, so they can read the full article with all the details and numbers and quotes at carolinajournal.com.
Katie Zender joins us this morning on the Carolina Journal News Hour.
Where it's now 5:15, News Talk 1110, 99.3 WBT. It's time to get a look at your Tuesday morning commute and update on traffic with Boomer Von Cannon.
Hey, thanks.
It's 20 minutes past the hour. Welcome back to the Carolina Journal News Hour. News Talk 1110 99.3 WBT. Billionaire tech mogul and presidential advisor Elon Musk has recently suggested privatizing Amtrak passenger train service, among other federally funded services, as his Department of Government Efficiency, drives for efficiency across the United States. During a virtual appearance at a Morgan Stanley tech conference earlier this month, Musk described Amtrak as a, quote, sad situation compared to high-speed rail in parts of Europe and Asia, telling the group, quote, if you're coming from another country, please don't use our national rail service. It's going to leave you with a very bad impression of America, end quote. He further argued that privatization would create a feedback loop for improvement, suggesting that inefficiency and waste in its current government-run form justified the shift. The push comes after Amtrak reported investing $4.5 billion in 2024 to upgrade infrastructure in its aging fleet, aiming for its first ever profit under the second administration for President Donald Trump. Yet Musk called it embarrassing and it's insisted that privatization is a fix that needs to happen. The White House hasn't committed directly, though Trump has historically been open to privatizing government services. Amtrak is a taxpayer-funded organization receiving billions of dollars in subsidies to keep it operating each and every year. While privatization has been proposed in the past, such efforts have historically been derailed in favor of more taxpayer-funded access to passenger rail services. And looking at the impact that might have in North Carolina, Amtrak provides a mix of state-supported and long-distance passenger rail in the Tar Heel State, making it a significant hub for rail travel in the Southeast. The state services are a blend of regional routes supported by the North Carolina Department of Transportation and national routes from Amtrak connecting major cities across the country. In total, North Carolina has 16 Amtrak stations. They include Charlotte, Raleigh Union Station, Cary, Durham, Burlington, Greensboro, High Point, Salisbury, Kannapolis, Rocky Mount, Wilson, Selma, Fayetteville, Southern Pines, Hamlet, and Gastonia. There are additional seasonal stops such as Lexington that is added during the barbecue festival and a Raleigh State Fairground stop that happens when that takes place in October. The Piedmont route links 9 of those cities across a 172-mile corridor. Charlotte, which is the third busiest station in the Southeast, and Raleigh's Union Station anchor the Tar Heel network, with over 281,000 passengers in the Charlotte stop, 246 in the Raleigh stop. That's fiscal year 2023 data. The Greensboro station rounds out the top 3 busiest nodes on the network, and everyone from those passengers cost taxpayers money. However, hence the target placed on Amtrak as the Trump administration focuses on saving money for taxpayers. As a growing state, some of the planned Amtrak expansions are a focus here in North Carolina as well. A Charlotte Gateway station is currently under construction to move Charlotte Station uptown. That's set for service later this decade. A Raleigh to Richmond, Virginia route is also in development, with service expected in the 2030s, and a proposed Salisbury to Asheville route with an estimated cost of $665 million is currently being discussed and proposed. As of now, Musk's proposal is just that, a recommendation. Trump recently reiterated the point of Musk and Doge, reminding the media that the cabinet heads and Congress are ultimately in charge of making cuts based off of those recommendations and findings. Congressional approval would be needed to privatize Amtrak, which has been government-owned and operated since 1971. And while Doge continues to drive efficiency efforts at the federal level, select North Carolina lawmakers have also been tapped to examine ways to realize cost savings and streamline state government. The North Carolina Railroad Company, NCRR, has been identified in the past as a valuable state asset that could draw a significant price tag to bolster other core functions of government. It doesn't need privatization, however. The 317-mile rail corridor from Charlotte to Morehead City is already private. The North Carolina Railroad Company is organized as a private real estate investment trust in which all stock is owned by the state. The company opted for REIT status for tax purposes in 1995, and the state acquired the remaining private shares in 1998. Also, unlike Amtrak, the North Carolina Railroad Company actually makes money, maybe because it's privately run, and is able to reinvest millions each year in its tracks and related economic development projects. As the state looks to fill big needs related to disaster relief, the potential sale of the North Carolina Railroad Company ownership might catch the eye of government efficiency committees that are meeting in Raleigh. When the state became the sole shareholder nearly 30 years ago, it bought out the remaining 25% of private shares for a whopping $62 million, implying a total valuation of $282 million at the time. Adjusting for inflation, that would be closer to $500 million price tag in 2025. Norfolk Southern operates freight on the line under a trackage rights agreement, while the aforementioned Amtrak uses the tracks for passenger rail services like the Piedmont and Charlotte routes. Given the role in North Carolina's economy and connectivity to Norfolk Southern's network, a buyer might pay an estimated $750 million to $200 billion to secure a monopoly such as this valuable corridor in the rapidly growing state that North Carolina is. That would also mean forfeiting millions to the state that they receive as shareholder dividends, and political resilience or buyer interest could skew the price. As Musk and Doge move forward with saving suggestions like privatizing Amtrak, the government efficiency efforts will likely continue to be mimicked at state levels, and it's something that we have continued to chat about over the last couple of days and weeks, as you've seen many of these discussions taking place at the federal level. Amtrak, one of them, talking about FEMA and disaster relief. That's been another major topic as well, and some major talks about how that can either be completely privatized or a lot of the bureaucracy, a lot of the red tape being cut out completely. It's something that we'll continue to track and cover over on our website, carolinajournal.com, and right here on the Carolina Journal News Hour, where it's now 5:28, News Talk 1110, 99.3 WBT. Time for another look at your Tuesday morning commute, whether you're traveling via rail or car. An update with Boomer Von Cannon.
Hey, thank
It's 5:35. Welcome back to the Carolina Journal News Hour. News Talk 1110 99.3 WBT. I'm Nick Craig. Good morning to you. Keith Siegel, a Chapel Hill native, is just a month out of captivity from Hamas. But rather than focusing on recovery, he is actively meeting with lawmakers on Capitol Hill and advocating for the release of remaining Israeli hostages. Last week, Keith and his wife joined other former hostages and family members in a meeting with President Donald Trump to advocate for his continued leadership in getting the remaining 59 hostages home. The Siegels were among 253 hostages taken captive by the terrorist group on October the 7th of 2023. His wife, Aviva, was released 51 days after the situation unfolded, but Keith was held captive for 484 days before he was released on February the 1st of this year. He recently shared 2 video messages on the Hostage and Missing Families Forum Instagram account calling for the release of the remaining hostages. This group was formed less than 24 hours after the October the 7th attack and is dedicated to securing the hostages' release by any means possible. U.S. Senator Ted Budd said in a press release, quote, "We rejoice in Keith's return, but we also weep for what he and his fellow hostages endured and for what the 59 remaining hostages and their families are still enduring." For 484 days, Keith's family, particularly his wife, his children, siblings, family, and friends, worked tirelessly to secure his release. Following the meeting with Trump, U.S. Senator Budd hosted a bipartisan meeting between the former hostages as well as Senators Jody Ernst, Rich Blumenthal, and Jackie Rosen to discuss and continue the conversation at the national level, with Budd saying, "Our work is not over. We must continue pressing Hamas to release the remaining hostages in Gaza, especially the 5 Americans. I will continue to work alongside my colleagues on a bipartisan basis with President Trump and with world leaders until all of the hostages are home and Hamas is destroyed." Throughout the middle part of last week, President Donald Trump, in posts on social media and in interviews, talked about a final warning to Hamas. However, there are still 59 hostages being held. 24 are believed to be living. The remaining bodies include 34 either killed during the attacks or in captivity as this event unfolded back in 2023. The Keith Siegel story, pretty remarkable. You can read additional details and click on additional coverage of his time in captivity and since his release by visiting our website this morning, carolinajournal.com, where it's now 5:38. News Talk 1110 99.3 WBT. We are continuing our coverage of some major changes coming to the state health plan across the state of North Carolina. A public meeting taking place on Friday of last week. To get some details on that, Teresa Opeka, carolinajournal.com, joins us this morning on the News Hour. Teresa, the state health plan is responsible for hundreds of thousands of individuals across the state of North Carolina. Can you give us a broad overview of Teresa, can you give us an overview of the dire financial straits situation that they're in right now?
Sure. Thanks, Nick, for having me this morning. Yeah, they're in big trouble at this point. Currently, they have a $500 million shortfall for 2026 and an additional $800 million shortfall for 2027 if something is not done immediately. What's been going on the last few years is they've averted giving price increases to the over 750,000 members of the state health plan because they've been taking it from reserves. But as State Treasurer Brad Briner said on Friday, they're tapped out. They have nothing left in reserves. There's nothing they could do to extend not increasing this. So they're looking at all different ways to, help bridge that gap at this point. And of course, nobody wants to hear about having anything rise in this day and age. You don't know where things are going to be going with the economy. So yeah, they need to take action, and they discussed that on Friday.
Well, and I'm glad you brought that up because for individuals that have private health insurance through an employer, most folks have seen their rates go up over the last couple of years. SHP was at least able to minimize that. But as you just noted, Teresa, they've depleted their reserves, and we're talking about some massive budget shortfalls that they're going to be dealing with. So is the solution going forward raising rates? Is that what we're learning?
Unfortunately, yes. How much they're going to go up, that's the thing they're trying to hammer out. They had a lengthy discussion on Friday. I think it was from 12:30 to a little bit after 3 that the meeting took place, about what they need to do. They talked about either raising, co-pays, premiums, maybe something out of pocket, choices of that nature, how also to cut costs, like getting rid of the clear pricing project. That was something that was developed by former state treasurer Dale Falwell to increase transparency, but unfortunately that did not work. So they're looking at all different ways to do that, and also removing maybe some prior authorizations for some drugs that come under $500. But one of the doctors who sits on a special board disagreed with doing that because he said most of those are opioids or of things that are more of an addictive nature. So they've been looking at all different ways. And Treasurer Briner said at the end of the meeting, we're going to do some really drastic things that you might think are pretty radical, but it's steps that they need to take because they're at that crossroads right now.
And this is an issue statewide, Teresa. We've chatted in the past about how North Carolina has some of the most expensive healthcare, if not the most expensive healthcare in the nation. It's being felt by everybody from the private to the public sectors here.
Oh, yeah. And that's been for the last couple of years. I know Forbes, and there was another, maybe it was the same magazine, they put out that North Carolina's got the highest healthcare costs in the country, and also maybe low accessibility in different places. So, something definitely needs to be done. Not saying that quality is bad, but the costs are definitely up there. So everybody's been feeling the pinch.
So as we go forward, many folks listening this morning themselves, or they might have family members or friends that are one of those 700,000 plus individuals that do receive health insurance through the state health plan. What are things going to look like as we progress through the rest of 2025, Teresa?
Sure. So they had that discussion on Friday. They are meeting next up in May to what they call the finalizing the benefit designs for 2026. Where they're going to put everything in place where they want to get those things in place. They also said Medicare numbers are coming out in April. They didn't talk too much about it. We do have a little bit of a graph in our story on carolinajournal.com that explains what they are looking at, but they didn't really go into too much detail. So again, they're meeting again in May. In August, they will finalize for the premiums for 2026 and vote on them at that point. And we were discussing, off the radio before that we don't know if they're going to have a discussion period or a public comment period where people can come to a hearing and discuss, between May and August, if, voice their concerns about the prices going up. Not sure about that yet, but we'll stay tuned for that and we'll keep you posted. And finally, in October, they will have open enrollment for 2026. So a lot on the agenda coming up for the treasurer and the state health plan.
And I want to make sure we reiterate, this is not going to be an issue for individuals, at least in this calendar year, that have already got their rates and everything done through the state health plan. But this will be something as we head into the latter parts of this year, the beginning parts of next year, that if these rates do go up, which, Teresa, it seems like that's probably the only path forward that people are going to be discussing, probably a major topic here across the state.
Correct. It's not for this year. It's for next year. They did have 7 people commenting last week. And like they said, even a $20 increase per month for those who are get paid the lowest, they can't afford that right now. They really vehemently discussed that or voiced their concerns on Friday. But again, yes, this is starting next year for 2026.
Teresa, you've got some pictures, some charts from some PowerPoints that took place during the meeting. Where can folks go in to check those details out this morning?
Sure, they can head on over to carolinajournal.com.
Teresa Opeka joins us this morning on the Carolina Journal News Hour. Where it's now 5:44, News Talk 1110, 99.3 WBT. Another look at your Tuesday morning commute, an update on traffic with Boomer Von Cannon.
Hey, thank you.
Good morning again. It's 5:51. You're listening to the Carolina Journal News Hour. Don't forget that if you miss any portion of our program live weekday mornings from 5 to 6, you can download the podcast. You'll find it wherever you get your shows, your favorite podcast app. Just search for the Carolina Journal News Hour, tap the subscribe or follow button, and take the show with you on demand on your own time. It's the Carolina Journal News Hour podcast. Download and subscribe now. The North Carolina Child Fatality Task Force is advising lawmakers this morning to take action against addictive social media algorithms that officials say are harming youth mental health across the state. The task force released its 2025 annual report last week, offering recommendations on how the governor and the General Assembly can create policies that will save lives. The report offers 11 recommendations that address a range of issues that threaten children's health and safety, including teens spending an average of 3.5 hours per day on social media. The report reads, quote, "Frequent social media use has been associated with changes in the developing brain. Youth who spend more than 3 hours a day on social media face double the risk of poor mental health," end quote from the report. According to DHHS, 1/4 of adolescents perceive that they are moderately or severely addicted to social media. Data shows that 78% of 13 to 17-year-olds report check their devices hourly, and 46% of them check almost constantly. That's compared to what it was at 24% just a few years ago in 2018. Social media use can interfere with sleep, and poor sleep is linked to a physical and mental health issues, risky behaviors, poor school performance, and altered brain development. Many experts and national organizations are expressing concerns and issuing advisories about the impact of social media on youth mental health. The U.S. Surgeon General advisory from a few months ago states children and adolescents on social media are commonly exposed to extreme, inappropriate, and harmful content. And those who spend more than 3 hours a day on social media face double the risk of poor mental health, including experiencing symptoms of depression and anxiety. House Bill 644 was introduced in 2023 to combat social media addiction. Though it had bipartisan support, it failed to garner substantial action in the North Carolina House at the time. Other proposals include more spending to increase the number of school nurses, social workers, counselors, and psychiatrists to deal with issues like addressing firearm safety and the likes. DHHS officials call for recurring funding of more than $2.6 million to the North Carolina SAFE campaign, which educates the public about safe firearm storage. In his previous role as the North Carolina Attorney General, Stein targeted social media platforms multiple times. Back last year, he joined 12 other states in suing TikTok, alleging it purposely was designed to keep children addicted. And in October of 2023, Stein and more than 40 other bipartisan attorneys sued Meta, which owns Facebook and Instagram, alleging a similar claim that the platforms were purposefully designed to be addictive to children. You can read the full North Carolina Child Fatality Task Force annual report. It's a lengthy one, about 56 pages, over on our website this morning, carolinajournal.com. And off of that, last week, the Senate, with bipartisan support, passed the Student Use of Wireless Communication Services bill that would effectively ban cell phones from use during class time. The bill, sponsored by State Senator Michael Lee of New Hanover County, Elisa Barnes of Nash County, and Jim Bergen of Hardnett County. Senate Bill 55 passed 41-1 in the North Carolina Senate. There were 7 excused absences, 5 Democrats and 2 Republicans, and 1 Senator, Terrence Everett of Wake County, who did not vote. Senator Ralph Hines, the Republican out of Mitchell County, was the only senator to vote in opposition. The bill reads, "The governing bodies of public school units shall establish a wireless communication policy. At a minimum, the policy shall prohibit students from using, displaying, or having wireless communication devices turned on during instructional time.
There are certain reasonable expectations laid out in the bill, such as to manage a student's health as required by medical documentation. The bill addresses the prevalence of phone-based childhood, a trend that began with the introduction of smartphones and subsequent rise in anxiety and depression amongst youth observed in the early 2010s. According to lawmakers, they have actively worked to investigate the issue further. Last year, some of the same senators, including Michael Lee, introduced a bill to study various cell phone policies in schools and heard from mental health experts and policy analysts on the subject at a conference hosted at NC State last year. There is another bill, House Bill 87. It is a companion bill that is working its way through the North Carolina House of Representatives, sponsored by Representative Neil Jackson. And we'll see if the House is able to coincide on this legislation as they continue to work, as the General Assembly continues to work on all of their various pieces of legislation and things moving back and forth from the House and Senate. You can read more details on Senate Bill 55 on our website this morning, carolinajournal.com. That's going to do it for the Carolina Journal News Hour. We're back tomorrow morning, 5 to 6, right here on News Talk 1110 and 99.3 WBT.